Good evening. Back pain is one of the most common reasons people go to a doctor and is a leading cause of disability worldwide. Most people have back pain at least once in their lifetime. Fortunately, you can take all measures to prevent and relieve most back pain episodes. To know more about back pain, we have with us today Dr. Muralidharan V, spine surgeon at Apollo Specialty Hospitals, OMR. Good evening, doctor.
Good afternoon, everyone.
What is back pain and what causes back pain, doctor?
Back pain is so common nowadays. So, what people mean by back pain is the pain which they experience in the lower part of their back, and what we call as lumbar spine. And this pain is felt between the ribs, where the ribs end, and down to the bottom, about down to the buttocks. The space between this is called lower back, and most of the time it is triggered by a small injury. The small injury could be either you'll be lifting something, or you'll be carrying, or you'll be pulling, or even as sometimes it comes on its own without any injury. And there are multiple causes for the back pain, and back pain can present at any age group, whether it be children or adult or elderly as we age. The most common causes for back pain is what we call benign, which is harmless, and it's most of the time it's by because of muscle strain, muscle spasm, or poor posture. And there are some causes which are very serious causes for the back pain, and they are the back pain originating from an infection or from cancer or from deformities. But most of the time, as I said, the cause for back pain, especially in young adults, are muscular in nature, and this is something we can prevent and we can manage with some awareness about the back.
Uh, there is something called acute back pain and chronic back pain. Could you tell us in detail about what acute back pain is and what turns out to be chronic back pain?
See, we categorize back pains based on the time period the patient has been experiencing, and we call someone to have an acute back pain when they present to us with a day history or a 2 day history following a lifting or sudden pull or sudden twist where they get acute spasmodic back pain. And those episodes are called as classified as acute, and we call someone to have a chronic back pain when their acute episode doesn't settle and it is present every day, or they experience that back pain within good and bad days alternating, and the back pain episode going beyond 3 months. So someone has a back pain which started 3 months ago and still has, and it's affecting their day-to-day life, then we call them going into a chronic back pain stage.
How do we diagnose a back pain, doctor? Are there any tests like X-rays, MRIs that are required to be taken?
See, for back pain, if we have a acute back pain, so for example, if you're in a gym, you're lifting everything in the wrong way and you get a sudden acute pain in your lower back, you know that you pulled a muscle something. And these ones, even if you go to your specialist or any clinician, and they will assess you and they will say that it's purely muscular nature. And in these cases, we don't need any extra investigations or imaging. But there are back pains where the pain might be coming from your disc, or pain might be coming from your slipped vertebra, or pain might be coming because of you may be having infection or tuberculosis in the spine. So those are the ones which need investigations, and we use plain X-rays, radiographs, and we use a non-radiation imaging modality called MRI of the spine, and we may use sometimes CT to assess the bone structure and everything. So these are the imaging modalities that we use to, depending on the patient's presenting symptoms and the underlying spine problems.
Hello, doctor. Of late, I have been experiencing shoulder pain, which is extending downwards at the back joint. Uh, my doctor says it's called something frozen shoulder. Sorry, it's called frozen shoulder. Is it permanent? Kindly advise.
See, the pain in the shoulder could be a pain coming from the shoulder joint as such, which we call the local problem, or it could be a pain coming from a slip disc or a disc problem from the neck, what we call cervical spine. So it is called a radiating pain from the neck down to shoulder, and sometimes the pain can travel down the arm and into the hand. As I said, if the local cause is from the shoulder, and it could be, well, because of frozen shoulder, where the shoulder joint becomes stiff and you lose the joint loses the ability to move, and it can give pain as well. Or it could be caused, sometimes you may have calcium deposit within the shoulder joint, which could be irritating the tendons that helps to move your shoulder. Or sometimes, as I said, it could be a central cause where it could be coming from the neck. You may have a disc bulge in the neck which irritates the nerve that carries signal to the shoulder, and that pain could be felt. So that your clinician will assess you and he will identify whether it is coming from the shoulder or from the neck, and will advise accordingly with a, may need a further scans, x-rays, and then he will treat you accordingly.
Earlier, you spoke about lifting the wrong weights in the wrong position and at the gym or workout. Why is the back more vulnerable to pain and injury, doctor?
See, basically, the spine, when you mean spine, you have bones, what we call vertebra, and you have a disc. What disc is nothing but a cushion, a shock absorber. So your spine is built of bones called vertebra, and with a disc in between. So you have almost 33 vertebra, and you have almost a disc between each vertebra from your base of the skull down to your lumbar spine. So when you stand, when you sit, when you bend, twist, force goes through your back. And especially when you bend and twist, the force goes through, that force going through your back multiplies. And this puts a lot of stress on your muscles as well as on the disc. So this damages your muscles and disc. So that's why you get back pain if you are in a job, or if you don't maintain your posture, or if you don't lift things in a proper manner. Your back muscles and this get more stress and will give you more pain. So that's the reason why we advocate use your knees and hips to go down so that your spine is straight when you're lifting anything. And this will reduce the stress going on your back muscles as well as on your discs.
Hello, doctor. I'm a 42-year-old working woman diagnosed with a vitamin D deficiency 8 months back. Though now it's in the normal range, I'm still undergoing and taking 60K vitamin D capsule once a month. What is the correlation between vitamin D and spine injury or spine related issues?
Essentially, vitamin D and calcium are very vital for the functions of muscles and bones. If you're deficient of vitamin D, then the strength of your bone, the bone mineral density goes down, and your muscle also will lack vitamin D. It will also lose its endurance and strength. So you are prone for easy aches in your muscle and in your bones and in the back. And also you develop what we call osteoporosis over the time. Your bones become soft, and even with a cough and sneeze, your bones can have a microfracture and you can have more pain. So to avoid that, vitamin D is essential. So we advocate a healthy diet which is rich in calcium and vitamin D. Unfortunately, vitamin D is obtained mostly through the sunlight. So we advise walking in a with the sun exposure for 30 or 40 minutes a day. And also, if you're deficient, you have to load it up with the vitamin D supplements so that your vitamin levels are optimum. And once your vitamin levels are loaded up, and we also recommend to maintain a supplementary dose so that you don't go back into a deficient state again over the time.
Having said that, who is more prone to a back pain or a lower back pain, doctor?
See, as I said before, all age group are affected, and there is no discrimination whether you are a man or a woman or a children or adult. There are reasons for back pain in each age group. If you take children, there could be because of the load of the school bag they're carrying, and the children get back pain at the end of the day. Sometimes if they have infection in the spine, they can present with back pain. In young adults, if you see, sometimes it's purely muscular because they don't sit or stand straight. It's a bad posture. They slouch down while using the laptops or slouch down while texting or using the mobile, and that can put stress on the muscles and give a back pain. Sometimes you can have a disc bulge, a disc problem, which is pressing the nerve, and in which case your pain is will spread down to the leg as well. Or as we age, the spine becomes aging process is inevitable, like how you get a white hair. Similarly, you have arthritis happening in all joints and spine, what we call spondylosis in spine. And this can give rise to a lot of degenerative problems like narrowing of spinal canal or slip vertebra. And they can also give rise to back pain. Another thing is nowadays we see cancer patients living longer, and if you have had a cancer, and there is high chance that the cancer can spread to spine and can give a rise to back pain. So there are multiple reasons. So, but most of the time, what we deal with is a muscle related, and some is a disc related, some is a aging problem where your bones are soft and can give rise to osteoporosis, pain, and fracture, and some is a aging, a degeneration process, and sometimes the pain may be from a cancer or an infection.
Could it be also that lifestyle is also a contributing factor, doctor?
See, though it's multifactorial, the most of the time it is a lifestyle, as you rightly brought it up. In my practice, 60% of walk-in patients complain of back pain. They're all young adults, and they ask the same question, doctor, I'm very young, why should I have a back pain? So the reason I tell them is, look, the cause for is multifactorial, but mostly it's lifestyle now, life changes and adaptation. See, most of us, our nowadays a computer or a desk-based job where they are sit 8 to 10 hours a day. They don't maintain the posture properly. That's one thing. You don't sit or stand properly. Second thing, you don't do regular exercises. They're so occupied that they don't have time to, do exercises for themselves. So lack of exercises means the muscles are not stretched, the flexibility of the spine is lost, and you get easy back pain with even sitting for some short time. So posture, lifestyle, and third is eating habits. So we munch on whatever is available. We don't follow a healthy diet, and we put more weight. The more weight means the more stress on the joints and the disc. So if you maintain your ideal body weight, you are less likely to have backaches. If your weight is more than what it should be, then your risk of having back pain, the recurrent back pain is more. Then again, sleeping. You need to have a good sleep, and also stress. Stress is also one of the cause, because the stress puts your muscles into spasm. The muscles tension is more, and you feel stiffness in the back, and you have pain most of the time. And again, lifestyle activities like hobbies, smoking and drinking. We know the smoking does harm to discs and may predispose you for more back pain. So put together, it is a combination of factors, and most of them are lifestyle factors that we will be able to modify to maintain a healthy spine.
What can I do to prevent my back pain from getting worse, doctor?
So there are a lot that you can do. First, you need to know what is the cause for your back pain. Is the back pain is muscular nature? So when I mean muscular nature, if you see, if most of my patients, young patients, they will say that doctor, I woke up normal in the morning. When I get to work, I'm all right. As the day goes off at work, by midday, I start having some aches in my back, and it gets worse in the evening. And when I come back to home, I'm all right. In the bed, I'm all right. I don't have any pain. So this is what typically we call typical back pain, and this is the benign back pain. There are a lot of things that you can do to prevent this. So firstly, you have to sit and stand in the right way, maintain your posture. So for this, you have to maximize, because all the offices or do have ergonomically designed workstations and chairs. So you have to maximize that so that you can maintain the curves of your spine, both at work and home, and avoid bad postures. And also try not to be glued to the chair for a long time. So take regular breaks, 45 minutes, 1 hour, get out of your chair, move around, come back, do simple shoulder stretches, back stretches while in the chair. And these things will help to reduce your back day-to-day back pain and manage it.
What should I expect to happen with my type of back pain? Will it go away? How soon should I approach a doctor?
See, as I said, most is simple, benign, harmless back pain is the most common one. If your back pain does not respond to simple remedies, like you may take some simple analgesics like paracetamol or ibuprofen, you may put some ice uh, packs and stretches, some physio. If the pain does not settle in a couple of days, then you need to see a spine specialist. And also, if your pain is different, that means you have a short pain all the time, whether it's morning, evening, night, and the pain disturbs your sleep, or if you have pain traveling down your leg and you have numb or pain traveling down the arm, if you have a numbness or tingling, or if you think your foot is weak, and if you have fever with your back pain, or if you had an injury before the back pain, or if you had a cancer and you have back pain, these are the ones, serious ones, that you need to go and see a spine specialist sooner.
We have a question. Hello, doctor. I'm 40 plus. My back often pains early in the morning just as I wake up from bed. Do you think I should consult a doctor? Is it serious? And what precautions should I take to avoid this early morning back pain? We've got this question from a couple of other viewers also on early morning back pain as they get up from the bed.
See, as I said before, I wake up with normal, I go to work, and my pain starts at work is what we call benign. If someone wakes up with a pain and they feel that back is stiff and they struggle to move around for a few steps, but after they've done a few steps, they feel better. So that is something what we call as could be an inflammatory problem behind the back pain, like what we call some inflammation in the spine, which makes the spine stiff. And common conditions are like ankylosing spondylitis, and there are a few other conditions as well. So when somebody in a 40s and they have a back pain ongoing and a stiffness and they wake up with a pain, we normally are a bit aggressive and we recommend some blood investigations and imaging, X-ray and MRI scan to pick up that inflammatory problem. If they have that inflammatory problem, then we commence them on medical management. Because inflammatory arthropathy, what we call like rheumatoid arthritis that affects the joints, there is an inflammatory problem that affects the spine as well. That is the one condition where people have back pain in the early morning. So that is the most common cause. Second cause is we always keep that is the bed giving you the back pain. Sometimes the bed, if the mattress is not adequate, designed for you, then people can wake up with pain in the morning, or people can have pain throughout the night.
Could it also be due to bad posture during sleeping?
Yes, yes, it could be because both sleeping posture and the mattress they use also accounts for back pain in the night, or they wake up with a bad back in the morning. Posture wise, we recommend to sleep. Side posture is good, or if you're a back sleeper, then probably you may have to use pillows under the knees, or if you're a stomach sleeper, that's bad. But if you can't avoid, then we recommend use pillows under your lower abdomen so that you may maintain the posture of your spine. Don't put much stress on your muscles so that you don't get much aches in the night or morning.
Hello, doctor. Is it okay to have over the counter pain relief medicines for lower back pain?
Yes, as I said, the simple back pain usually resolves with home remedies, which is you can take paracetamol, Dolo 650, or ibuprofen if you're not allergic to it. Some ice application for a day or two, that will settle down. But if you have any red flags, and what means that the problem is serious, that means first constant pain all the time. You're not able to sleep with pain. You have pain going down the leg. You have pain with fever, pain with loss of you're not feeling that you're eating or you're losing weight, and if you have any weakness in the legs, these are times you need to go and see the doctor. And these are the times that you should not be taking any over-the-counter medications. If your pain persists for more than 2 or 3 days, go and see your specialist for the advice.
What are the chances that my back pain will result in a permanent disability?
It's a very difficult question to answer. It depends on what is the cause of your back pain. Is it your back pain is from some structural problems, like you have a your infection and it, or a injury or a cancer and you're paralyzed? That is different. But if you just have a back pain because of the muscle problem and a simple disc problem, then these can be managed and you can improve your functional abilities. If somebody had an injury and they're paralyzed, then yes, the disability is permanent. But somebody has a muscular problem, chronic back pain due to muscular problem, poor posture, or due to disc problems or a disc bulge, these can be addressed and you can go back to your full functional ability without any restrictions.
I have cervical issues, doctor. 7 days back, I had a mild neck pain. I ignored it, which led to severe neck pain, and lower back pain started post that. It's really bad now. I'm having painkillers almost three every day, apart from, and my doctor is not in town. What should I do?
See, you need to see who the any other specialist available. You have to go and see a spine specialist. If your specialist is not available, if you should not sit and wait until your specialist comes in. He may be at the town. So I would recommend you go and see another physician, and then they will make a assessment and they will advise you whether you need to go for a further imaging like X-ray or MRI to see whether there is any disc or anything or any infection causing the pain.
Hello, doctor. Can yoga help relieve or keep away from lower back pain?
Yes, certainly. As I pointed out earlier, stress is one of the cause for backaches in young adults. Yeah. So those working in desktop jobs or any sort of firm, any industries, people are enormous stress at work. Stress puts the muscles into tension and predisposes them for back pain. Yoga is currently advocated to de-stress themselves, and also simple yoga stretches your back muscles and increases the flexibility of your muscles, your joints, and it helps to reduce your back pain and also helps to keep you active and mobile. So certainly for a back pain, what we call is there is no single therapy like just medications or just a physiotherapy or just a yoga. It is a multimodal therapy, and that includes medicines, exercises, physiotherapy, and yoga. So the combination of this will help people having chronic back pain to come out of it and lead a healthy life.
What can I do to prevent injuries while playing sports?
See, injuries are completely unavoidable uh, while doing sports, because the sports is always there is a risk something. But how do you minimize it? By maintaining your muscle strength. For that means you should be regularly doing exercises, back exercises, core muscles, your quads. So, and also doing stretches before the exercise games. Like what sort of games? Whether it's a racket sports or any field sports or a contact sports, whatever it is, whatever sports it is, you have to do stretches before the game. And you should be doing regular exercises to build up the strength of your muscles and the bones so that they minimize your risk of injury.
டாக்டர்ஸ் தமிழ்ல நம்ம வியூவர்ஸ்க்கும் பேக் பெயினை எப்படி தவிர்க்கலாம்ங்கிறது சொல்ல முடியுமா நீங்க?
பேக் பெயின் பேக் பெயின் எப்படி தவிர்க்கலாம்னு பார்த்தீங்கன்னா, இப்போ ஆஃபீஸில் வேலை செய்கிறவங்க, சேரில் இல்லை கம்ப்யூட்டர் பேஸ்டு வேலை செய்கிறவங்கலாம் பார்த்தீங்கன்னா, அவங்க உட்காரும் போதோ நிற்கும் போதோ ஒரு கரெக்ட் போஸ்டரில் நிற்கணும். இப்போ எல்லா ஆஃபீஸில் இருக்கிற எல்லா சேர்ஸுமே பார்த்தீங்கன்னா பேக் பெயின் லம்பார் ஸ்பைனை சப்போர்ட் பண்ணுற மாதிரி தான் இருக்கு. ஸ்பைனை சப்போர்ட் பண்ணுற மாதிரி இருக்கும். அதை வந்து அவங்க மேக்ஸிமைஸ் பண்ணிக்கணும். அதே மாதிரி அவங்க வந்து உணவு பழக்கங்களையும் கரெக்டாக வச்சுருக்கணும். வெயிட் போடாமல் இருக்கணும். அதிக வெயிட் போட்டால் பேக்கோ ஸ்பைனுக்கோ அதிக வேலை கொடுக்க மாதிரி இருக்கும், ஸ்ட்ரெஸ் கொடுக்குற மாதிரி இருக்கும். அதனாலேயும் பேக் பெயின் வர வாய்ப்பு இருக்குது. ரெண்டாவது, அதே மாதிரி புகைப்பழக்கம் உள்ளவர்களுக்கும் பேக் பெயின் அதிகமாக இருக்கும். ஸோ புகைப்பழக்கத்தை தவிர்க்கிறது நல்லது. அதே மாதிரி தூங்கும்போது கரெக்டான முறையில் தூங்கினா, இப்போ சைட்லேயோ இல்லை பேக்லேயோ படுத்துட்டு தூங்குறவங்களுக்கு பேக் பெயின், பேக் மசில் ஸ்ட்ரெஸ் கம்மியாக இருக்கும். அதே மாதிரி வயிற்றில் படுத்து பழக்கம் உள்ளவங்களுக்கு பார்த்தீங்கன்னா பேக் மசில் ஸ்ட்ரெஸ் அதிகமாக இருக்கும். காலையில் எழுந்திரிச்சா வலியெல்லாம் இருக்கும். ஸோ அது மாதிரி இது பண்ணிக்கலாம். ரெகுலராக எக்ஸசைஸ் பண்ணணும். ரெகுலராக பேக் மசில் ஸ்ட்ரெச் பண்ணணும். ரெகுலராக வாக்கிங் ஆர் சைக்கிளிங் ஏதாவது பண்ணிங்கன்னா உங்களுக்கு மசில்ஸ்க்கும் எலும்பும் ஸ்ட்ராங்காக இருக்கும், பேக் பெயின் கம்மியாகும். அதே மாதிரி பார்த்தீங்கன்னா விட்டமின் டி என்றது கால்சியம்ன்றது முக்கியம். ஸோ உணவுப் பொருட்களுக்கு கால்சியம் அதிகமாக இருக்கிற உணவுப் பொருட்கள், பழங்கள், காய்கறிகள் சாப்பிட்றது, சூரிய ஒளி படுற மாதிரி ஒரு 40 நிமிஷம் நடக்கிறதோ சைக்கிளிங் பண்ணுறதோ இல்லை ஏதோ விட்டமின் டி உடம்புக்குள்ளே வர மாதிரி பார்த்துக்கணும். இதெல்லாம் இருந்தால் எலும்பும் மசிலும் ஸ்ட்ராங்காக இருக்கும், பேக் பெயின் கம்மியாகும்.
When does surgical intervention required, doctor?
நான் முன்னாடி சொன்ன மாதிரி surgery is not required for all cases of back pain. So 80% is benign. We manage with patient education and simple physiotherapy, exercises, yoga, medication. But there are 15 to 20% of the patients where back pain is because of disc problem, disc bulge, or a slip of bone on another vertebra, aging problems, osteoporosis, an infection. So these are the cases which will need surgery in the form to relieve pressure on the disc, on the nerves, disc in the fusion surgeries, spinal infection decompression surgeries, or deformity surgeries. So mostly the disc surgeries, either we will remove the disc or fuse the disc. Is mostly when the back pain is because of disc problem, and that disc problem is affecting their quality of life.
இது டிஸ்க் ப்ராப்ளமா இல்லையான்னு தெரிஞ்சுக்கிறதுக்கு முதல்ல அவங்க ஸ்பெஷலிஸ்ட் ஆகணும்.
ஆமா, ஸ்பெஷலிஸ்ட் பார்க்கணும். சரி, அது செட் ஒரு 3 days 4 days சிம்பிள் பேக் பெயின் அவங்க மேனேஜ் பண்ணலாம். அதுக்கு மேல பெர்சிஸ்டண்டா இருக்கு, இல்ல பேக் பெயின் காலுக்கு போகுது, காலில் மரத்து போயிருக்கு, இந்த மாதிரி இருக்கும்போது they have to come and see a specialist. We will assess, ஒரு ஸ்கேனோ எக்ஸ்ரேவோ பார்த்துட்டு we will decide what it is. இப்போ நார்மலாக ஒரு டிஸ்க் பல்ஜ் ஆச்சு அப்படின்னா we don't go in and do the surgery straight away. We give 3 to 4 weeks for the body's nature to deal and heal it. So பாடியால கிளியர் பண்ண முடியலன்னா தான் சர்ஜரி பண்ணி கிளியர் பண்ண முடியும்.
Can alternate therapies help, doctor?
There is no concrete evidence in the medical literature to say that alternative therapies like yoga, acupuncture, அதெல்லாம் வந்து chiropractor, acupuncture, இதெல்லாம் வந்து permanent cure கூட. They all give a temporary cure and it's mostly subjective feeling. நம்ம ஒரு தெரப்பி பண்ணோம், காசு கொடுத்தோம் அப்படின்ற ஒரு ஃபீலிங் இருக்கும். யூ வில் ஃபீல் a temporary relief. பட் அதுக்கப்புறம் பார்த்தீங்கன்னா it will come back. So the solid permanent solution அப்படின்னா, இப்போ டிஸ்க் ப்ராப்ளம் அப்படின்னா you follow advice of your clinician. If it is a muscle problem, it's purely your responsibility. How you sit, how you stand, your exercise, your eating habits, these all will help for your back pain.
I had a neck sprain last week, which has now led to right shoulder pain, arm pain, and numbness in my thumb. I have a feeling that I have exercised too much. What should I do, doctor?
See, exercise too much will give you pain in the muscles, or the muscle soreness. What we call a delayed onset muscle soreness, DOMS or something. It will not give a pain going down your arm or a tingling or numbness. Tingling or numbness will only happen when at the disc, the shock absorber between the bones is bulging, and when it presses the spinal nerves. That is the only time where you will get an electric shock, like pain going down the arm, numbness. In your case, I think you must have had a disc bulge, and that is why you have pain going down the arm and numbness and tingling. It is nothing related with the exercise or anything. You will have to see the spine surgeon, and you will have to have a MRI scan to see what is the disc, where is the disc, how big it is, and what is needs to be done based on the scan findings.
நிறைய பேர் கேட்டிருக்காங்க, லோவர் பேக் பெயினுக்கும் கேஸ்ட்ரிக் பெயினுக்கும் எனக்கு எப்படி வித்தியாசம் கண்டுபிடிக்கிறது அப்படி?
இப்போ லோவர் பேக் பெயின் பார்த்தீங்கன்னா see back pain பார்த்தாலே back pain க்கு one of the common what we call differential diagnosis. இப்போ பெயின் வந்து அது பல காரணங்கள்ல இருக்கலாம். பேக்ல வரும்போது முதல் காரணம் லோவர் பேக் பெயின், லம்பர் ஸ்பைன்ல இருந்து வருது. ரெண்டாவது காரணம் கிட்னிஸ்ல இருந்து வரலாம். மூணாவது காரணம் ஸ்டொமக்ல இருந்து வரலாம், இல்ல பேன்க்ரியாஸ்ல இருந்து வரலாம். மண்ணீரல் சொல்லுவாங்க, பேன்க்ரியாஸ்ல இருந்து வரலாம். பட் லோவர் பேக் ஸ்பைன்ல இருந்து வர பெயின் பார்த்தீங்கன்னா இட் வில் பி இன் த லோவர் பார்ட் ஆஃப் யுவர் பேக் அண்ட் இட் இஸ் சூப்பர்ஃபிஷியல் மசில்ஸ்ல இருக்கும். பட் இந்த கிட்னியோ இல்லை ஸ்டொமக்லேயோ இல்லை பேன்க்ரியாஸ் சொல்கிற மண்ணீரல்லையோ வர பெயின் பார்த்தீங்கன்னா முதுகுக்கு மேலே இருக்கும் கொஞ்சம், அதாவது ஹை இன் த பேக். அண்ட் ஆல்சோ அந்த பெயின் பார்த்தீங்கன்னா ரொம்ப டீப்பாக இருக்கும் உள்ள. இந்த லோவர் பேக்லேருந்து வர்றது சூப்பர்ஃபிஷியலாக இருக்கும், லோவாக இருக்கும். ஸ்டொமக்லேருந்து வர பார்த்தீங்கன்னா மேலே ஹையாக இருக்கும், அதே மாதிரி ரொம்ப டீப்பாக இருக்கும், உள்ள இருக்கிற மாதிரி இருக்கும், முதுகு தண்டுக்கு உள்ளார இருக்கிற மாதிரி இருக்கும். ஆனால் ஆல்சோ உங்களுக்கு வயிறு உபசம் அந்த மாதிரி சிம்டம்ஸ்லாம் இருக்கும், ப்ளோட்டிங், அப்டாமினல் ப்ளோட்டிங், அதெல்லாம் ஒரு சிம்டம்ஸ் இருக்கும்.
As we celebrate World Spine Day this month, what is your message for our viewers today, Doctor?
See, every year October 16th is observed. It's not celebrated. It's observed as a World Spine Day, just to raise the awareness about spinal health. See, for my message would be, see, most of the back pain we see nowadays is back pain young adults. See, your spine is supposed to be healthy, and for that what we recommend is maintain a healthy lifestyle by doing regular exercises, regular stretches, so, and also maintaining a healthy lifestyle. So eat fit, so don't put on more weight, and also maintain proper posture, whether when you are sitting, standing, or sleeping. And also be stress free, do some yoga, and spend some time for yourself, so de-stress yourself. And also maintain good habits, avoid smoking, and these things will help you to have a healthy spine. So basically you have to keep moving, stay fit, so that your spine is healthy, and you can have a productive adult life.
Thank you very much for an informative session, Doctor. For appointments with Dr. Muralidharan, you may contact 044 3322 1033. I repeat, 044 3322 1033. Thank you very much, Doctor. Thank you, viewers.
Thank you, viewers.